Hey everyone, and a huge welcome to all of you focused learners out there, especially those of you stepping into the world of animal care and veterinary science. Welcome to this explainer. Today we're going to completely break down a highly complex and honestly rapidly evolving threat, highly pathogenic avian influenza, specifically the H5N1 strain. We're going to take this all the way from the micro level, what actually happens on the front line in a clinic or on a farm, right up to the macro level, looking at the massive global and national regulatory responses.
So here's our roadmap for today. We'll be hitting 6 key areas. 1. The H5N1 threat. 2. Spotting the signs. 3. Frontline prevention. 4. Official outbreak response. 5. Epidemiological principles. And finally, 6. Protecting New Zealand.
All right, let's jump right in with Section 1, the H5N1 threat.
To really wrap our heads around the threat of avian influenza, we have to look at it through the lens of One Health. As animal care professionals, this concept is basically your daily operating environment. The One Health approach recognizes that we literally cannot separate the health of our domestic poultry from the wild birds flying overhead, the human handlers working in the barns, or the shared environments they all live in. It's like a giant puzzle where every single piece is connected.
Take a look at this intricate transmission cycle. It's wild how it works. Wild aquatic birds, like ducks and geese, act as these natural, often totally asymptomatic reservoirs. As they migrate, they carry and shed the virus. This then spills over into domestic poultry flocks, and from there, through close contact with infected feces or contaminated material, it can spill over again into wild and domestic mammals, marine mammals, and yes, occasionally straight to humans. It is just a massive, interconnected web of transmission.
Now, what's really keeping experts up at night right now is this specific strain, H5N1 clade 2.3.4.4b. Since 2020, this specific clade has been causing massive poultry losses all over the globe. But what makes it so uniquely concerning is how it's adapting to mammals. It's now known to have infected over 40 different mammal species. We're talking everything from foxes and farmed mink to sea lions, and it's even recently established itself in U.S. dairy cows. It is a highly dynamic, incredibly adaptable threat.
Moving right along to Section 2, Spotting the Signs.
So what does this actually look like in practice? Contrasting these clinical symptoms is absolutely crucial because you need to protect your patients and yourself. In birds, you've got to be on high alert for green droppings, a low appetite, a ruffled appearance, and specifically swollen infraorbital sinuses and respiratory discharge. Now compare that to human infections. While humans definitely can get severe respiratory distress and fever, recent human cases in the U.S., especially those linked to infected cattle, predominantly showed severe eye redness or conjunctivitis. Honestly, knowing these specific signs is your very first line of defense.
Which brings us to Section 3, Frontline Prevention Strategies. Let's talk about building your daily defense playbook. Out in the field, biosecurity is everything. If you're handling birds, you absolutely must isolate any newly acquired or ill birds the second you notice something's off. You have to meticulously clean and disinfect cages and waste. Always use reliable bird sources. And, this is a big one for your own safety, wear your proper protective clothing and PPE. Also, just maintaining good general animal husbandry, like providing proper nutrition and minimizing stress, does wonders for keeping those animals' immune systems strong.
Okay, stepping back to the big picture with Section 4, Official Outbreak Response.
Let's say the worst happens. You suspect an outbreak in the field. Your immediate, non-negotiable duty is to notify state or federal veterinary authorities, like the USDA. Why? Because highly pathogenic avian influenza is officially classified as a foreign animal disease, or FAD. This classification is the bureaucratic trigger for massive government emergency protocols. Because it's so contagious and poses such a severe threat to agriculture and public health, it demands mandatory regulatory intervention. You do not try to manage a notifiable disease like this on your own.
In the real world, the absolute second a presumptive FAD case is identified, authorities don't just work in their own little silos. The USDA, alongside affected states and tribal nations, immediately form a unified incident command. It's a total all-hands-on-deck situation to ensure a massively coordinated response for quarantine, movement controls, and tracking.
Once that unified incident command is up and running, they have 3 exact mandates. Step 1, rapidly detect, control, and contain the spread. Step 2, eradicate the disease to stabilize the food supply, which, unfortunately, often means the mass culling of infected flocks. And Step 3, use science-based approaches to facilitate business continuity for the non-infected animals. It's a really tough balancing act between stopping the virus in its tracks and keeping the agricultural economy alive. Let's dig into the science behind those actions in Section 5, 3 Epidemiological Principles.
If you're an animal care student, you absolutely must commit these 3 foundational rules of epidemiology to memory. Every single strategy authorities deploy is based on one of these. First, you quarantine farms to prevent contact. Second, you cull infected flocks to stop the production of the virus. And third, you use vaccination, like the updated H5 vaccines they're using in chickens in some countries, to increase resistance and reduce shedding. For sure, that is the science of outbreak control in a nutshell.
Now, we've talked about global transmission and the U.S. regulatory framework, but let's shift gears for a second. How does a highly contagious intercontinental threat like this actually impact an isolated ecosystem? Say, a place like New Zealand. Let's explore that in Section 6, Protecting New Zealand.
You might think geographic isolation is a perfect shield, right? Well, actually, scratch that. Despite being an island nation with incredibly strict agricultural imports, New Zealand's environment is still super vulnerable. And it all goes back to those natural reservoirs we talked about earlier. Wild aquatic birds, carrying the virus entirely asymptomatically along their global flyways, pose the absolute primary risk for introducing H5N1 into New Zealand. Mother Nature really doesn't care about border checkpoints.
Because this threat literally arrives on wings, New Zealand relies on a highly structured pre-pandemic framework. We're talking strict border controls combined with top-tier One Health surveillance, constantly tracking wild bird populations. Crucially, they also maintain a pre-pandemic vaccine reserve. And if a threat is ever detected, they already have a plan to prioritize vaccines for folks at the highest risk. That means border staff, lab workers, and frontline veterinary workers, meaning people exactly like you who are out there handling the animals.
So, what is the ultimate goal of New Zealand's entire massive apparatus? It all boils down to one strategy: suppression. They want absolutely zero community spread. From tracking those wild birds, to swift movement restrictions, to rolling out that vaccine reserve, the whole system has one very aggressive objective: break the chain of transmission before it ever truly begins. And you know, that brings us right back to you. We've traced this from a microscopic virus adapting to new mammals, looked at the clinical signs, and scaled all the way up to unified command and national suppression strategies. But remember, every single part of that response starts with detection. As a current or future animal care professional, you are literally the front line. So are you prepared to spot those green droppings or swollen sinuses? Are you ready to lock down your biosecurity, report a notifiable disease to the authorities, and be the one who actually breaks the chain of transmission? Keep these principles close, stay vigilant out there, and hey, thanks so much for joining me on this explainer.